Hello everybody, in this video we are going to discuss about Staphylococcus epidermidis. If we break this word, we have Staphylococcus, which refers to a cluster or a bunch of cocci bacteria, and epidermidis, which is associated with the word epidermal or the epidermal layer of the skin. Hence, it indicates that Staphylococcus epidermidis is the normal flora of the uppermost layer of the skin or the epidermal layer of the skin. Some features of this bacteria are that it's novobiocin sensitive, catalase positive, coagulase negative, urease positive, gram positive, a facultative anaerobe, a non-sporing and non-motile bacteria. It is the most dominant bacteria on the skin. An important point to keep in mind is that it's a common contaminant of blood culture since it is a dominant bacteria of the skin. It also contaminates prosthetic devices, IV lines and catheters. A characteristic feature of Staphylococcus epidermidis is its ability to form biofilms. And that's how it contaminates prosthetic devices, IV lines and catheters. These biofilms make it very difficult for the immune cells or for antibiotics to gain access to this bacteria and to kill it. Hence, its ability to form biofilms is a very important and characteristic feature which makes it so resistive and makes it so strong and non-treatable. In order to identify a patient with a Staphylococcus epidermidis condition, the patient may have pain, he may have some kind of discharge that comes out from maybe the place where we've placed the IV line. That area might feel tender, it may be red, he may have chills, fatigue and have a headache. He may also suffer with fever. If this bacteria manages to reach the bloodstream, it may lead to bacteremia. One of the most common complications that occur from Staphylococcus epidermidis is prosthetic valve endocarditis. Symptoms of patients suffering with prosthetic valve endocarditis are fever, valve dysfunctioning, and in order to check, we can either do a blood test wherein we'll find contamination of Staphylococcus epidermidis, but since Staphylococcus epidermidis is a common contaminant of blood cultures, hence it's better that we perform a transesophageal echocardiography. We will be able to figure out if there is any kind of growth of bacteria on the valves that have been put in. Another complication that's possible is prosthetic joint infections. Prosthetic joint infections are when there is a contamination of the prosthetic joint during surgery. Fever, redness in the prosthetic joint area, pain around the prosthetic joint. In order to treat Staphylococcus epidermidis infections, if it is on a prosthetic device, we'll have to remove the prosthetic device. We commonly use vancomycin to treat these infections, but if the patient is suffering from a methicillin sensitive strain, then we can also treat them using oxacillin or napsillin. So this was an overview about Staphylococcus epidermidis, the general features of the bacteria, the conditions or complications that it causes, and the treatment measures. I hope this video was helpful in understanding this bacteria and its associated concepts. That's all we have for today. Thank you.